To start getting you those answers. You sent us questions. Let's turn them over to our coronavirus expert. We're joined on the phone by Dr. Erika Hamilton, a microbiologist from UMass Amherst. Dr. Hamilton, TGIF.
I agree.
Well, the big news here today is talk about this vaccine. And the first question we have for you is the Oxford University. The scientists there, they say a vaccine could be ready by September to January timeframe. Is that a realistic expectation? I mean, these things, that would be fast, wouldn't it?
It would be incredibly fast, and I don't think it's realistic. I do not think you're going to be able to go to a doctor's office in September and get a vaccine for this. And there's a couple reasons why. The first is that the clinical trials that all medications and vaccines have to go through, and then the vetting process by groups like the Food and Drug Administration is extremely strict. And the reason for that is so that you don't put something on the market that's going to harm people. Less than 10% of all vaccines and drugs who go through clinical trials actually make it to use in patients. So this Oxford University group has less than a 1 in 10 chance of having their vaccine be usable. The other problem we have is that there aren't that many factories across the world that are able to make vaccines in large numbers. It's a process that has a lot of regulation to it for obvious reasons. And we would need tens of millions of doses of a COVID vaccine. And at the moment, we don't have the equipment or the factories to be able to make that large of a volume of new vaccine in the amount of time that we would need it in. So at some point, yes, we will have a vaccine, and yes, you will be able to get one, but the chances of it being in September are really, really low.
Yeah, this would be the first round of it as well, so you just have to hope the thing even worked in the first place, as we've seen in the past. Some of them haven't. Okay, so second question comes from Netta, and it goes, you probably looked out the window, with rainy days like this, can this kind of weather kill the virus?
Not really. It's not, the virus is not that sensitive to weather changes. Obviously, if you're outside and you cough and it's raining out, the rain will force the little aerosol droplets you've coughed out to be washed out of the air more quickly. But this virus doesn't seem to be that particularly sensitive to cold, dreary days, unlike us who are sensitive to it.
Yeah, you're looking at one right here, folks. Okay, so the third question, new research coming from Harvard University actually shows communities hardest hit by COVID-19 in Massachusetts have high levels of air pollution. Do you think it's a surprise that air pollution may actually play a factor with this virus? After all, it is respiratory, right?
Right, and that's what the issue is. So in pollution, there are these tiny, tiny little particles that are in the air, and you breathe it in, and it goes into your lungs, and it hurts your lungs. It can cause some physical damage. It can cause some inflammation. And so if you contract some type of a respiratory disease like COVID-19, it can predispose you to the disease becoming worse. And the same is true if someone vapes or if they smoke any type of a tobacco or marijuana product. Any of those activities where you're introducing particulate matter and possibly toxins into your lungs hurts your lungs and then predisposes you to not necessarily catching COVID-19 more easily, but it going from a mild case to a severe case is more likely if you breathe in air pollution or smoke.
Very informative, as usual, Dr. Erika Hamilton. We appreciate you coming on here today. Hope you stay healthy and have a fantastic weekend. And we'll have more from experts like Dr. Erika Hamilton here in the coming days, folks. Just tune in each weekday here at 12:30. We'll get you those answers.